If you look at health results, that is results in terms of longevity, rates of cure from cancer, heart attacks, etc. By the 1980s, the West German system was much more effective. It was a healthier system than the GDR's was. And one could argue, certainly, if you want to just look at it that way, that free healthcare and the GDR was associated with less good outcomes overall. But that blanket statement really has to be qualified in several very significant ways. Number one, basic healthcare in East Germany, in the GDR, was quite good when it came to, in particular, women and child healthcare, infant mortality, young child mortality, and maternal mortality. These were a major focus of the East German health system. They did everything they could to bring those down, and they were very, very effective at doing that, especially for a country, a state, that was not generally a wealthy state. They brought them down to the points where they were sometimes lower, and even in the late 1980s, when East Germany was not doing well, infant mortality, maternal mortality were barely higher in East Germany than in the much richer West German system. So basic health, I would say, was a major, major focus, particularly women and child health in East Germany, and there was really no gap between practice and theory there. They did everything they could to improve those and to improve the health and likelihood of survival of women and children. West Germany also has over time done a much, much better job in that. And today, of course, infant mortality and maternal mortality in Germany are much lower than in the United States. But when it came to cancer, cardiovascular disease, all kinds of other diseases, West Germany ended up doing such a much better job. I don't think it was because healthcare was free in East Germany that was the case, but because generally it was a much poorer state and simply did not have the technical expertise that developed in West Germany, particularly in the 70s and 80s, and since then, of course. So I don't think it was that people didn't pay for it, but it was that they generally did not have the money to put into that, and perhaps, didn't want to put the money into that. That's a different question. I think that it is a canard, or how would you say, it's a distraction to say that not paying for healthcare makes it worse, because there are always interests in any system that are in various ways driving up cost or asking for services. For example, doctors can do that. It is not at all clear that if you look at free healthcare systems, nationalized healthcare systems, that on average they are worse. We could look at France, we could look at England, both of which have nationalized healthcare systems.